today's video, I wanted to have a chat to you about nausea and vomiting in pregnancy, as around half of pregnant women will suffer from this. It is often called morning sickness, but it can happen at any time during the day. Nausea and vomiting commonly start at around 6 weeks and will usually resolve by around 16 weeks of pregnancy. However, unfortunately, in some women it will persist throughout the whole pregnancy. Some risk factors for nausea and vomiting include if this is your first pregnancy, if you are having a multiple birth, for example if you're having twins or triplets, if you have suffered from nausea and vomiting in a previous pregnancy, or if you have a family history of morning sickness. If you are suffering from nausea and vomiting in your pregnancy, I can only imagine how exhausted you must feel and not your usual self. But if at any point you notice that you are losing weight, feeling dizzy, having any abdominal pain, passing less urine, or if it's more concentrated than usual, then you should go to your local early pregnancy assessment unit or your local accident and emergency department to be checked out. If you are seen in hospital, they'll be able to check your levels of dehydration, and depending on how dehydrated you are, they'll be able to give you fluids through a drip to rehydrate you and give you some anti-sickness medication. However, this will depend on the doctor's assessment of you when you go into hospital. So a few tips on how you can manage your nausea and vomiting in pregnancy include eating small amounts regularly, try to avoid any foods or smells that make you feel sick, eat plain foods, regularly sip on small amounts of water. Try to avoid drinking large amounts of water too quickly, as this can make your nausea and vomiting worse. Avoid any fizzy drinks. You can try sucking on some ice cubes if you can't manage any other fluids. Some people find ginger can help, so maybe try some ginger tea. And the most important thing is to rest, because if you're tired, this will make your nausea and vomiting much worse. Another way to manage your nausea and vomiting in pregnancy is taking anti-sickness medication. There are many different types, and the most commonly used in the UK are cyclizine and prochlorperazine, and these are entirely safe for baby. Your doctor will take a medical and drug history from you to make sure that these medications are appropriate for you, and they will guide you on how regularly you should be taking them. Another medication which I think is important to mention is ondansetron, as this is another good anti-sickness tablet. There are some studies that suggest that it may increase the risk of heart defects and cleft palate in baby in early pregnancy. Therefore, ideally, it shouldn't be taken until after the first trimester. You may have heard of the term hyperemesis gravidarum, and this is the term used when a pregnant woman suffers from severe nausea and vomiting, which stops you from doing your daily activities and you don't eat and drink as usual. This affects approximately 1 to 2% of women during pregnancy. Nausea and vomiting usually has no impact on the growing baby. However, if you do have hyperemesis gravidarum, it can increase the chances of your baby being on the smaller side, and it can affect you to have a preterm delivery, which is delivering your baby before 37 weeks of pregnancy. But if you do have hyperemesis gravidarum, you'll be monitored closely by the obstetric team, and you will have regular checkups during your pregnancy. It's reassuring to remember that for the majority of pregnant women, the nausea and vomiting will improve as the pregnancy progresses, and there are different medications and things that you can try to manage the nausea and vomiting during your pregnancy. If you do have any concerns or you feel like you're struggling, then do contact your local doctor or do attend your local emergency department in an emergency. I really hope this video has helped, and if you have any questions then please just comment below and I'll be more than happy to answer them, and I'll see you in the next video.